Well, my name is Robert Rowen. Most people know me in ICIM and in integrative medicine for my work in Alaska, getting a law passed protecting unconventional medicine, and now for my work in oxidation therapy, primarily ozone. It's a holiday season. It's chilly. You'll have to forgive my informality here. I'm just very comfortable here at home on a cool day. I want to be speaking at ICIM together with my Sierra Leone blood brother, Howard Robbins. I call him my blood brother because both of us took a chance and went to Sierra Leone during the Ebola epidemic in 2014 to teach ozone therapy to African physicians. And we risked ourselves, and it was for naught, but it wasn't for naught. We were chased out by the government that was pressured by pharma indirectly. That we found this out after the fact. So pharma had to be scared to death of what we were doing to put the WHO up to get us out. We taught direct intravenous ozone, which is one of the things we'll be talking about at ICIM. The main thrust of the talk is on ozone therapy. It's one of the oxidation therapies, which includes high-dose vitamin C, which most everybody does, intravenous peroxide, which some people still do. We don't because it's hard on veins. Ultraviolet blood irradiation, which many people do, and ozone, which is the most versatile. We want to explain the biochemistry of ozone, what it does, and the works of especially Silvia Menendez and Vilio Bacci from Italy. Menendez is from Cuba, and summarize why ozone is indispensable. And if you're not doing it, you really ought to be doing it. What does it do, or what do I use it for? I use it for just about everything. And there isn't anything, in my opinion, that it cannot assist, because the fundamental of the healing, the fundamental of life and health is oxygen. We'll explain why ozone is very good for that and getting more oxygen to the tissues, how it modulates the immune system, how it seems to upregulate oxygen consumption, ATP production. So we'll describe fundamentals of ozone biochemistry. We will discuss the various ways ozone is delivered. It's delivered primarily through local injection, and hopefully, I believe we're going to have a machine there. Dr. Robbins is bringing his machine to Philadelphia from New York, so that is a real plus. With that machine, he can demonstrate his DIV technique, and we can do a few local injections, but we're not going to be demonstrating major autohemotherapy because it involves a lot more medical waste, and it's more problematic. But the really simple stuff we can do. He's going to demonstrate his DIV technique, which he thinks is superior to conventional major autohemotherapy, and he'll explain why. And both of us will explain its limitations. I'll be presenting the recent papers I published on ozone and its value in infection and immune modulation. I've got some case reports. Howard will demonstrate his technique. He'll be discussing ozone. Well, again, we'll be discussing ozone in general and the various aspects of ozone, its history, its biochemistry, its uses, how it can be used in the office. We can get into also some of the economics of it, the machines that are available, what doctors can charge for it fairly. It is probably the best investment any physician can make, bar none, because the ozone machine that I use costs over 10,000 euros. I have several of them, and we pay for them all in just a matter of a couple weeks. I think that's a good return. The most important thing is patient satisfaction. So I will be bringing some videos of real-life patients that I have, and this will include local injections and Lyme disease. Now, Lyme disease is huge, and I am going to talk at length about this and how we use ozone for Lyme disease. Howard can chime in on his method, too. We use a more sophisticated method called hyperbaric ozone, and I will have a video of this to present so the participants can see how it's done. and I will explain how we treat Lyme disease and share that we get results that I don't think very many other places get. We're easily getting 80% of our Lyme patients better, significantly, long-term, indefinitely, maybe even 85%. So we're using Ozone for Lyme. It's an adjunctive treatment for cancer. I will explain that as well. Adjunctive. Now, we have seen some total remissions, but it's an adjunctive treatment. I will go through all of the uses of Ozone, from blood to bladder to saunas, local injections, IM injections, joint injections. There's going to be didactic, but I'm a very informal presenter, as most of the people know, especially in a workshop. And this is going to be an exchange for people to ask questions and pump us for everything we can deliver. And by the way, I'm not there to sell any machines. I am going to tell you what I think about certain machines and problems with certain machines and what you need to be prepared for, because you need to know what you're doing. And a lot of Ozone doctors don't even know what they're giving because their machines are not calibrated, and they don't even know it. So we will be talking about that too. And the goal is that the doctor can go back to his office afterwards and begin doing simple Ozone, which would be Robin's DIV. And we'll talk about the controversy about DIV Ozone, and also maybe a knee injection, because a knee injection's real easy, and I do plan to do it while we're there.